Hello, my name is Dr. Omarine. I'm an ER physician in Texas, and I'm here to encourage those of us who work in the medical field to take better care of ourselves. So, if you work in the medical field or you know someone who works in the medical field, this message is for them. Especially those of us who do shift work. So this applies to those who work in nursing homes, rehab facilities, you may even be working in somebody's home or in the hospital. This is a story that happened 2 days ago. So it just happened last week. I am going to tell you the story, and then I'm going to give you just a few suggestions on how you can take the lessons from this story and apply them to your life. Because my goal here is just to encourage all of us to take better care of ourselves. We give a lot to the medical field, so let us not take care of others and not take care of ourselves. So I'm going to call this lady Jane. Jane is a lady who is in her early 50s, and I've worked with her at the hospital for a few months. She has been in the hospital in the medical field, been a nurse for over 30 years. The hospital that we work in, the emergency room is very busy, and the patients are quite sick. They have a lot of medical problems. It is not uncommon to have a night where you have so many sick patients that you don't even have the time to sit down and eat anything. It is not uncommon to have patients who code, which means that they lose their pulse and have to be on life support or have to be emergently flown out to other bigger centers or have to be admitted in the ICU. So this is quite a busy hospital. I worked with Jane on Thursday night. So our shift starts at 7 p.m., ends at 7 a.m. in the morning. So I worked with her Thursday night, Friday night, and then on Saturday night I came in, and the first thing I asked was, where is Jane? Because Jane is the charge nurse, which means she's in charge of all the other nurses. And they said, well, Jane called in, they've called her, they've texted her, they didn't reach her. Come to find out, 2 hours later, her son calls us and says, Jane, she had gone shopping with someone, and they were in the store. She fainted, and they called the ambulance. They tried to resuscitate her. They even flew her to a different hospital. They didn't get her back. So Jane was a very hardworking nurse. She used to work. Her standard was to work 6 days a week and have 1 day off. And a lot of times in this hospital, because the patients are so sick, they used to have shortage of nurses. So they would ask her to do extra shifts. And so it wasn't uncommon for Jane to work. In addition to the 6 days a week that she always does, she will work sometimes 10 days in a row, be off for 1 day, 12 days in a row, and be off for 1 day. And we will always talk with her. We started talking to her and saying, hey, Jane, please slow down. But she had a project that she was trying to save money for in November. So she said, you know what? She used to tell us, don't worry. I am working hard because I have this project in November. Once I'm done with this project, I will stop. I will take a long vacation, then I will stop working this hard. But unfortunately, she did not make it. This is not the first time that this has happened. This is not the second time. All the nurses who are listening to me, all the doctors who are listening to me, everybody who works as an LVN, a CNA, care workers who do shift works, you are aware of these stories. But why don't we make the changes? So permit me to just give you 3 things that I have noticed as a problem. And I will just permit me to give you 3 simple solutions. The first issue that I've seen is number 1, procrastination. Procrastination. I'm talking to you and I'm talking to myself. You see, a few years ago, I myself, Dr. Omarine, I almost had an accident. Why? I was working a lot and I almost fell asleep at the wheel. When that happened to me, I woke up and I started implementing changes in my life. I started going to see my doctor. I started getting my routine checks. I started exercising. I started drinking water. I stopped procrastinating. The reason why we procrastinate is because we are busy. We are mothers, we are fathers, we have so many things pulling us from so many areas. But if you do not have a body that works for you, if you don't have a strong, healthy body, then, and you continue to break down that body, then it's just a matter of time for that body to stop working for you. So, the solution I want to propose to you today is, if you are listening to this information and you know you need to take better care of yourself, maybe you need to see your doctor, maybe you need to get a mammogram, maybe you need to drink more water, maybe you need to exercise. Pause the program and go and do something small. Do it today and do it now. If you know you need to drink more water, pause this program, go and drink a glass of water. If you know you need to exercise, pause the program and do 3 jumps. You have exercise, or walk in place. Don't hurt your knees. Walk in place for 1 minute. Problem number 1 is procrastination, and the solution is do it today. Do it now. Problem number 2 is this. We do not prioritize our health. Why don't we prioritize our health? Because we feel fine. We feel fine. Jane has been a nurse for over 30 years. So, of course, she is aware of the signs of, something wrong in her body. So, why didn't she seek help? That's because there are a lot of silent. You may have something brewing underneath. There are a lot of people who come into the emergency room with very, very high blood sugars, very, very high blood pressures, and they do not even know that they had hypertension. They did not know. So start prioritizing your health. I started prioritizing my health for the sake of my kids. So the problem number 2, I said problem number 1 was procrastination, and the solution was do it now. Problem number 2 is not prioritizing our health. And the solution is do it for someone else. We tend to prioritize others more than ourselves. When I had my almost car accident, I thought about my 3 small kids and I changed immediately. So if you're not going to make these changes today for yourself, think about your children. Think about what their life or whoever it is that depends on you, or your potential life in the future. I know not everybody has kids. But think about how your life will change if something really bad were to happen to you. This lady, her son now doesn't have a mother. And this project that she was trying to do in November, I don't know what's going to happen to the project, but was it really worth it? Was it really worth it? And the third problem that I've noticed is this. We do not personalize it. So you may be listening to this information and you say, well, this is so sad. This is a sad story. But you think that, okay, it could happen to others. It will not happen to you. This is not in our family. It is not in our bloodline. God forbid. You are a human being. And these things happen to anybody. It happens to anybody. So the problems are we procrastinate, we do not prioritize, and we do not personalize it. The problems are we procrastinate, we do not prioritize, and we do not personalize it. And the solution is start now. Start now. If you're not going to do something for your kids, if you're not going to prioritize your health for yourself, prioritize it for someone else who is important to you. And see yourself as a human. These are human problems. This is not a white people's problem. Africans get sick too. And it's not someone in your village who is, doing something. It could just be because you're not caring for yourself properly. I hope that this information helps someone out there. Again, you and I, as physicians, as nurses, as CNAs, as LVNs, should take better care of ourselves. And in this audio, I just want to give you some practical things. And this really applies more to women who are in the diaspora, African women who are in the medical field, who are in the diaspora. One of the issues I've found is this. I mentioned in the previous video that we procrastinate. And the reason we procrastinate is because we're so busy. Why are we so busy? Well, most of the time, nurses, physicians, pharmacists, LVNs, CNAs, all the workers in the medical field, we work 12 hours a day most of the time, or sometimes 8 hours a day if you're working in the clinic. And then what do you do when you come back home? You're taking care of kids, you're taking care of the house, you're cooking. So you're basically doing 2 full-time jobs. A lot of our African medical people, women, have nannies, but they have those nannies only when they are at work. So what that means is that you don't really get a break. You come back home and you continue. So my first recommendation is this. Number one, you may have to sacrifice some of that money. Some of that money that you're making, you may want to sacrifice some of it to get someone to help you in the house, even when you're in the house. I have gotten comfortable with someone in the house watching my children and I am sleeping. I have gotten comfortable with someone coming to help me with chores in the house. I've gotten comfortable. I have had a lot of the women I talk to, they do not have any kind of help because there's always a financial reason for it. But my dear, we are the same people who do befitting burials. We are the same people who spend tons of money on parties and events. So for me, I have become unapologetic about hiring help in the United States to come and help me with chores like laundry, like cooking, like cleaning of the home. And this is not just because I'm a doctor. Some people say, well, it's just because you're a doctor, you have the funds. No, remember that a lot of times the more money you make, the more things you have to do with it, the more that is required of you. I do it as a sacrifice, not even as a sacrifice. I do it as an investment in my mental and emotional health. So one of the reasons why we procrastinate and we don't have time is because we don't invest in help. Invest in help, regardless of how much you make. I'm telling you, my dear sister, if you look at what you spend on food that sometimes we throw away in the USA, if you look at how much you're sending home for a house that you may never even live in, for people who may be even taking the money and doing what's what, I don't want to go there. But you could be investing that money in getting people to help you with those practical things that suck your energy. I made a decision a few years ago, and my decision was that if I can get someone to do it for me, I am not going to do it. Call me lazy, call me whatever you want to call me, but this is an investment in my emotional and mental health. Because as my children grow older, I have to take care of them. A lot of our African women in and out of the medical field are so exhausted because you have so much to do. You work all day long. You come home, you do so many chores. You have to go to the grocery store. You have to go here, go there, do all these commitments. And then you don't even have time to raise your children or teach your children or be there for your children or just sit with your children. You're shouting, you're screaming because you're tired. So my sisters, I'm talking to you, I'm talking to myself as well. Get help in America. Invest in help in America. It's an investment in your mental health for practical things like laundry, cooking, cleaning of the house, grocery shopping. And you don't only have to get those things when you are off and when you are working in the hospital. Get those things when you are off, when you are at home, when you are at home as well. Number 2, I made the decision that I must have a certain number of days a week off. So I must have a day off to myself. No housework, nothing else. No housework, no kids, no catching up with anything. Because what tends to happen is this. We work Monday through Friday. Saturday, we spend the whole morning cooking, cleaning. Then we go to meetings and parties and events in the evening. And then on Sundays, we go to church. And then after church, we do this and do so many things. When do you care for yourself? When do you care for yourself? I've seen a lot of women who the only time they really even look put together is when they're going to church or they're at or they're going to an event, because you're basically working 7 days a week. You're working all day at work, you're working all day at home, and then you're keeping up with social events. So one practical thing you can do is make sure you have one day off for yourself, nobody else. So the first suggestion was get help, invest in help, no matter what your paycheck says. Number 2, have a day off to yourself. And then number three is something that I learned from a businessman. A businessman said this at a seminar that I went to, and it really changed my life. He said, stop making goals, have standards. If I tell you that my goal is to brush my teeth in the morning, or I tell you that my goal is to feed my children in the morning, or to feed my children, what am I saying? I'm saying that it's an option. I'm saying that, well, if I wake up and I don't feel like brushing my teeth, I may not brush my teeth. I'm saying that if I don't feel like, feeding my children, or if something happens, I may not feed my children. But if I say my standard is to brush my teeth in the morning, my standard is my children shall have a good meal in the morning, then it means that it is going to happen regardless. And again, I'm talking to those who are in the diaspora. So make taking care of yourself a standard, not a goal. Because standards don't change. Goals can change based on how you feel. I hope this helps somebody. Thank you so much for listening.